Hello guys, welcome to our YouTube channel Nursing Source. Here I am presenting the child health nursing. The important topic is cardiovascular system, unit 1. Let's start the topic. The topic is congenital heart disease. Introduction. What is a congenital heart disease? Here the structural defect in the heart that exists from birth. Here, the structural defect in the heart that exists from the birth at birth is called congenital heart disease. It also known as CHD, congenital. It's the short form of the congenital heart disease. It can be a hole into the wall of heart. It can be a hole into the wall of heart and blood vessels problem and issue with the blood flow regulating valve in the heart. Hole in the wall of the heart, blood vessels problem, issue with the blood flow regulating valve in the heart. The next is cyanotic heart disease. The cyanotic heart disease, it involves different heart disease present at birth. Cyanotic heart disease, we can say present at birth heart disease. It can cause low oxygen level, refers to the bluish coloration of skin and mucous membrane. It can cause low oxygen level, refers to bluish coloration of skin and mucous membrane. Let moving to the next. Here the causes and etiology of cyanotic heart disease. Reduce the blood flow into the lung, and less oxygen delivered to the baby. Forceful mixing deoxygenated blood with the oxygenated blood. It will happen like the hole into the heart. Because of that abnormal heart chambers. Next, moving to clinical manifestation and sign and symptom. The first one is bluish coloration of lips and finger and toe. Breathing problem, dyspnea. Tenderness and fatigue. It's not tenderness, it's tiredness and fatigue. The types, decreased pulmonary flow. Type number 1, it involves tetralogy of float, and second one is trapezoid arteria. It's not a trapezoid anesthesia and other ventricular heart with the pulmonary cyanosis. Next, type number 2 is increased pulmonary flow. Here, transportation of greater arteries, and second one is total abnormal pulmonary venous rhythm. Let's come to our first topic, tetralogy of float. We can say TOF also. It's a birth defect in this. The child heart does not develop. It's a heart defect in this. The child heart does not develop correctly, thus interfering with the normal blood flow through the heart. Here, etiology and causes. Narrowing the pulmonary artery and ventricular septal defect, VSD, ventricular septal defect. And next one is overreading aorta. Means oxygenated blood shift right side of the heart. It leads to overreading of aorta. The next is hypertrophy and right ventricle. Hypertrophy and right ventricle. Let's move to next. Pathophysiology. Pathophysiology. The pathophysiology. Blood from systemic circulation. The blood from systemic circulation, it goes to right atrium. After right atrium, it goes to right ventricle and pulmonary artery resistance, VSD, ventricular septal defect. Here maybe hole is there, right ventricle and pulmonary artery resistance. Then it goes to left ventricle and aorta. It goes through left ventricle and aorta. Then next, right to left shunt. Then it will leads to cyanosis. Cyanosis is a disease condition in this bluish discoloration of the mucous membrane and skin. Here polycythemia will happen, and then increase the viscosity of the blood then after slowing down the circulation that leads to CAV, cardiovascular anesthesia. Let's move to our clinical manifestation, sign and symptom. Low blood oxygen level, shortness of breath, and shortness of breath, bluish coloration, loss of consciousness, and clumping of fingers, and poor weight gain and irritability. Then next is the diagnosis evaluation. Pulse oximetry, have to do pulse oximetry and ECG, electrocardiogram, then chest X-ray, cardiac catheterization. The cardiac catheterization, they are inserting from vein from the arms and legs into the heart to see any inflammation is there or not. Management. The medical management is prostaglandin infusion, drug. Next, move to surgical, complete repair and temporary palliative surgery. Here surgical complete repair and temporary or palliative surgery. You can add the nursing diagnosis also, and whatever you can write according to this topic. Then I'm ending this topic, and thank you. Please subscribe my channel and comment like to my channel and my videos. Thank you all.